In most cases, you walk in and your client is already on the table. Now, the first thing that I want to look at is positioning. I'm not treating David as if he was a real client. Right now, he's a model for demonstration. Of course, I would assume that you had a good intake conversation, that your client knows what to expect, and more importantly, that you know what your client would like to get out of this session. But right now, I just want to get over positioning when the client is lying prone, so face down. So if you can put your face in the face cradle, please. That's usually the first problem. I often see this when I'm teaching classes. If you see like a crick in the neck, that is because there is a crick in the neck. In most cases, you need to really drop the face cradle down a little bit more than you think. And David, if you can tuck your chin a little bit, yes. So you want to see length here. In most people, you're not going to see creases in the neck if the face cradle is properly set up. Is this feeling okay for you?
Very comfortable.
Great. So that's what I want to hear. Very comfortable is what he says. Now, the next awkwardness is usually with arms. Mostly you're being taught to have the arms laid out flat. In his case, this works really well. So we could just do a treatment just like that. But I also like to have the option of having something up front where the arms can rest. Now, some tables come with face rests, but if you with armrests, but if you don't have that, improvise. If you're doing house calls, you can ask people for a little stool, a little ottoman, and you just place their arms on there. Can you put the other hand on there? Perfect. Okay. This way, you have the shoulders drop down a little bit. You have the shoulder blades come down a little bit. So this is already opening up a bit more space in here. So as you see, it depends a little bit on which area you want to be working on. And then you set up your client depending on that. And always make sure that you ask them whether they're comfortable. Now, we haven't even looked at feet and legs yet. And in a way, it's a problem to have a model with a really good body because they don't have the usual problems. And most people, you will see that their feet aren't as flexible as David's. So they're going to be somehow awkwardly be sitting on their toes and then falling over to one side. That's why it's usually necessary to have a bolster. I work a lot with just little towel rolls because I can adapt them, adjust them, roll them up in different ways. I want the bolster to rest right underneath the ankle. And I want it to be possible that, the foot still has some play here. So it's ideal to really put one under each ankle. But of course, if you have fancy bolsters in your clinic, that's what you would use. But don't be afraid to improvise. Now we also want to look at the low back, because a lot of people, when they are very lordotic, they're going to be lying there and you're going to see that the pelvis is rotated forward so much that there's a deep dip in the lumbars. Again, David doesn't have those problems. Your clients might. If your clients have low back pain, this is a real problem. And they don't tell you. You would usually assume that people say something if they're uncomfortable, but it's just what they used to. They lie down on a table and they feel like this is how it is when I get a massage. My back always hurts. So keep this in mind. Once you have your client positioned on the table, you ask them, how does your back feel? Particularly when you know that they have low back pain. And then if you don't have an adjustable table, you can just place a little pillow underneath the pelvis and make sure you put it to a spot that is comfortable for your client. The most important part really is their comfort. They should be able to sink in, to really feel like they can let go. They don't need to hold any additional tension, and particularly, you really don't want them in pain. For a lot of the techniques that I like to show, you want to have your client lie on the side. A lot of you might only have heard this about pregnancy massage, but there are plenty of reasons why it's really useful to have somebody lie on the side, and you want to make sure that they're stable, nicely supported. So you need a bit of a pillow under the head. Try this out, please. Yeah, that looks about right. So this could be even a little bit lower, but not much. You want to make sure that you can really lengthen their spine and that it's all in one line. Now, of course, what lacks on support is something for his knees. What you often see is that people are using a bolster between the knees. In this case, I prefer to have just one under the front knee. So he just bends the top leg, puts his knee on the bolster. I always like to use towel stacks or wrap a pillow into a towel because then you can really adjust the height. People who have wider hips will need a higher height. You want to make sure that the hips stay nicely stacked here. And you want to make sure that the bottom leg is long on the table. You can test this out just by bending the knee back and forth a little bit, and you want to make sure that the ankle can always lie down on the table. If it's not like that, it would look more like this. The foot would come up when you're bending the knee, and then you know you have a torque on the knee. So it's helpful to just give a little tug on the leg, make sure that you really have it lie flat on the side. And from here, you can look up the spine, see that you have nice alignment through the whole body, because that way you're perfectly set up for the work that I'm about to show you. To properly support the body when lying supine, I also like to use a little folded up towel that you can place directly under the occiput. So then you just get this little bit of a lift. And in his case, this is already too much. Folding the face cradle out of the way. If I pull this back a little bit, he gets a bit of traction on his head. So this should work out nicely. If I would feel like he's bending back way too far, I'll just open this up a little bit. Here we go. So you can also use the slope of the table to just gain a little bit of traction. You will see that sometimes you have clients, and if they're very stiff in the upper back, so they're already bent forward from here, and then they're lying down on the table, they're going to be looking like this. So then you just need a higher stack. You always try to have the spine nice and long. So you might have to play around with different positions for different people. Make sure that they're not uncomfortably leaning back, because that creates a lot of tug on the spine and it pretty much produces a crick in the neck. So you'll have to find out together with your client, and you have to teach them to let you know whether they're comfortable. For most people, it's a lot better to have support under the knees. That's again the relationship with the hip flexors and the pelvic tilt, pulling on the psoas muscle. So if you're giving people a bit of support under the knees, you're just giving the hip flexors a little bit of slack. If you have those people who really have severe low back pain, and particularly more when they're lying flat, then you might really add a lot more support. I have a few clients and I really have to put a whole ottoman on the table. And then I put the sheet over it and I put their knees on it. So in those cases, their legs are almost at right angles. Make sure you ask your clients about these things, because a lot of them will not tell you. They think it always hurts. They think you're the expert. You know that they're hurting, and they will not ask for the modifications that they don't know of. So make sure you work together with your client, make sure they're comfortable. And while you're positioning them, you can already create this sense of caring and comfort just by making sure that the bolster is correctly placed, that the legs can easily turn a little bit. You want to have the feet pointing straight up, kneecaps pointing straight up. And this little bit of traction can already feel really comfortable and help them settle in for the rest of the session. So this is the one myofascial stroke that I want everybody to learn. And Vanessa is demonstrating this really nicely. There's not much that I can correct. What I like to point out is how well she has aligned her whole body with the direction of the stroke. So we're working right next to the spine. It's just a little bit parallel to the spine, to the outside. She's using about the third lower part of her forearm, so it's not the tip of the elbow. And you see how she has a very slow glide going on here in the body. So if you just start the beginning of that stroke again, so you just move backwards. What very often happens when people try this out the first time is that they get confused with the position of their arm. We're so geared wanting to work with the hands that often I see people doing this because they really desperately try to get their hand on the body. And then they work with the whole surface of their forearm. So then usually they get way too much friction. They kind of get stuck in there. Or what I also see is that there's so much focus on just the point of contact and this area to be worked on that they completely forget that they have another hand. Vanessa is also showing this really nicely because she's using the pull on the superficial fascia here to get all the way underneath her forearm in here. So this is already a perfect demonstration. I don't know what to correct. Even in her own body, she has a little bit of a twist in her spine, but there is no constriction. And this little bit of a twist actually helps her to drop more of her weight into her forearm. So you see the direction of her foot. You see how the back heel is lightly lifted. That helps her stay in one direction, and it helps her take the push from the ground to drop her weight into her forearm here. You see those strokes are super slow. And all she needs to do is just take a little bit of a step closer in order to follow the release of the tissue. So this should happen almost by itself. It should really feel like you're just gliding away. So you can do the exact same thing mirrored on the other side. You will be tempted to do everything with your dominant hand. Try to protect yourself from that. While you're learning a new technique, it's much better if you force yourself to use both sides evenly, really mirror what you're doing on one side and do it on the other side evenly. It's going to make it much better for you to keep your body up as a therapist in the long haul. Now you see how slow those strokes are. What often happens is that you feel like you're not getting anywhere at all. If you have the sense that there is movement, that's good. But if there's no movement at all, you might want to correct the angle. So if we're just faking it a little bit, if you come in a lot closer, so you're kind of right on top of your elbow. Yeah, that's what I really see in classes very often, because that's what we're used to. We think about the area we want to be working on, and then we're in there, and then the next thing we would do would be to pull on the arm, which is not what we're trying to do here. We're trying to get the glide just by dropping our weight into the body. So if you get stuck, it's possible that it is because you're too much over the body and you're actually just applying compression. You want to have an angle. You can think about having about 45 degrees to the body. So the way to get there is to just back up. And that's counterintuitive because you think so much of the area you want to be working on that you don't consider going away from it. But that's really what you have to do. You have to open the angle in the elbow here. Now you can exaggerate that in order to show how this will speed up your stroke. So if you back up even more, we see that the stroke gets a lot more superficial. Exactly. And then you're just gliding on the surface. Okay, now you can back all the way up, start the stroke correctly. In this case, David's tissue is really good, really receptive. It is quite easy. So you really need no lubrication at all. If you're working with somebody you're practicing on where it is that easy, it's great to start. You will notice later on that you feel like you're getting stuck in the skin and you feel tempted to oil it, but make sure that you don't just slip away. If somebody has really super dry skin and they have a lot of hair and you don't want to be pulling on the hair, you might use a little bit of lotion, but really very sparingly because you want to get the sense of sinking in deep. You really want to open up these different upper layers. The idea is to always mobilize one layer on top of the others. In these techniques, we're not thinking about trigger points. We're not trying to release tension out of the muscle. We really just want to open up space in between different layers. Another one of my favorite strokes uses a different tool. So before we've worked with the lower part of the forearm. Now we get into a soft fist, particularly these knuckles. In my case, this knuckle really sticks out, which is an advantage because I can hook it under the edge of the trapezius muscle and then bring that muscle back and down. Now, what I like to show my students is a bit controversial, but I really like tucking the elbow into the hip. So really I use the ASI is in here in order to stabilize the elbow, and then I can bring my whole weight into that elbow. What's necessary for that is what you see very nicely in Vanessa's forearm here. You make sure that there is one straight line. Because if you have your wrist at an angle, this nice push where you're using your body weight so you don't have to work out of the shoulder, it gets lost in here and you extend a lot of pressure on your own wrist, and you will have to use muscle in order to apply the stroke. If you put it all into one line, what happens is that you use your body weight through this line and the force ends directly in the client's tissue where you want to have it. So this way you can really work smartly. You don't use a lot of strength and you can work for a very long time quite easily. Now the idea from this stroke is that you come from far below. So in order to truly do what I wanted to show here, you would have to really bend down almost like in a low lunge, exactly. Because you want to have the angle of your forearm pointing slightly up. Yes, that's perfect. And now you want to use a little bit of this glide on the tissue. So you stay from below. Yes, you go this way. Perfect. Exactly. This is really great when you're working with people whose shoulders are slumping forward, who might really have so much tension in the traps that it really looks like this build-up. Their ear is pulled towards, their shoulder is pulling towards their ear, like the traps keep pulling forward and in, the shoulders rolling forward. So this is the best technique to easily bring this backwards so that people can get into this graceful, effortless posture where the shoulder just falls away from the ear instead of being pulled. And you're doing this expertly, beautiful. So you already notice how far you've gone. You can transition this into a stroke that goes parallel to the spine just by coming up a little bit and then you're changing your angle. Now you can still tuck the elbow into the hip. It's like you have to make a decision. Either you're staying with the bent elbow or you're getting into a straight arm stroke, and then you can still use the exact same thing. So just for demonstration's sake, try that out. Step backwards a little bit. Really straighten the arm, because now the idea, you might have to step back a little bit more, because now the idea is that through this whole straight arm, you're applying the force. Make sure that you line yourself up with a stroke. You might want to step this foot a little to the left. Exactly. Because you want to bring your body so that you have all one direction. Yep. 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 So this is a little harder on your body than using the forearm stroke, but the advantage is that often you have finer tools in working with your knuckles, so you can apply force a little bit more targeted. So we would use this stroke after we had done the forearm stroke before. Okay, great. In order to open up space underneath the shoulder blade, I mean, we've all been trained in these kind of techniques to get into the medial angle, but we often forget about the lateral angle. So it's good to use these kind of knuckles. You can also use the soft fist, but if you're able to use these, make sure you have a long line again, going all the way to your elbow, and then you tuck this into your hip so you can just use your body's weight and you don't have to work hard out of the shoulder. Now, what you want to make sure of is the idea is really just peeling the shoulder blade off the body. So you have to adjust your angle, because if you're coming from here, you're really just poking into the ribs. So you want to move a little bit around. Yep. And then it gets trickier with the hip. Yep, exactly. So you want to make sure that you have one long line here. The force of your movement goes kind of almost in one line with his rib cage. So you imagine that you're going in this direction instead of that direction. Yep.
It's okay to lean on the table?
Yeah, sure, totally. You can totally, I mean, you can halfway sit on the table. That sometimes happens to me. Yep, exactly. Now, in David's case, this is really easy. You will have a lot of people where you feel like you just hit a brick wall. And then all you do is you just hang out a little bit. You pretty much just wait. You can do a little more if you use the other hand and you can put that onto the shoulder on top. You keep this one where it is, keep the alignment with the hip, and then you can pull his whole shoulder off the table and backwards. So this way, you're only holding a fulcrum here, and then you add movement. Perfect, exactly. So this is a really nice way to free up range of motion around the shoulder joint. Thank you. In order to address the pelvic girdle in the prone position, you will work a lot with people who have low back pain. You'll see later that actually my preferred position for these areas is having people lie on the side because you have less of a likelihood of getting these back spasms that sometimes happen when people start moving on the table or if they get up after a session, which is particularly tricky because often with the traditional massage framework, you're not even there when they get up. So be careful in those areas if people have a tendency to back spasms. But if they really just want all over good work, you can just work out of the valley of the lordosis in here upwards towards the kyphotic curve. Don't bore down into the deepest part of the lordotic spine, because particularly if people have a deep angle in here, you're only increasing that. So you want to stay out of that. You want to allow for length. So the whole idea, the thought that should stay in your mind is always wanting to lengthen structures. Now this is perfect in your body mechanics. I really like this. You're leaning into the table far enough that you can really bring your weight behind the stroke. You're aiming towards his ear. You stay within this line parallel to the spine. I like that you really drop your weight into your shoulder, and then this ends in the soft fist in here. The other hand, wonderful. You can just use it to pull a little on the superficial fascia. If you are needing to, you can even use the thumb to just work right next to the spine. You could even get inventive and work around the shoulder blade with the other hand. So the more familiar you get with this type of work, the more you're actually able to do detailed work with both hands. In the beginning, just having the other hand on the body feels good to the client. It doesn't need to do anything. You want to avoid that you're in here like this with like half your attention out here in the room. It really feels different to the client when you are coming in, you're really closely connected, and the other hand just needs to touch. I've also often heard when I was teaching classes and I asked the student on the table how it feels to them, and in cases where they're kind of a little bit sensitive in one spot, the other hand helps to distract from that. So you've been doing great because while I was explaining, you're moving so slowly. And that really is key too. If you have a stroke that slow with this sense of depth and direction and intention, you do all the work in one stroke and you're done, and we can move on to the sacrum. In order to address upper glutes and outer rotators of the hip, you want to work right on the sacrum to get all of those attachments. So when you're starting out, you use broader touch. You use this part of the forearm. And in this case, you're not looking for a classic myofascial stroke. You really just want to lean into those attachments. So find contact with the bone. Imagine the sacrum just as this triangle, and you kind of go for the outer edge of this. And so while you're on there, having the sacrum in here, you just gently glide off the bone into the soft tissue. And that's where you drop in more of your weight. So at first, just making contact with the bone in order to figure out where you are. That is very light. And then you get off the bone and sink in. Very nice. And you already notice if you find areas that you want to work on more with all these types of techniques, we're really aiming for the dips in between the different attachments. So we're not trying to work on the belly of one muscle. We want to separate the different structures and allow for more space in between. So the more you're lifting your hand, the more you actually use the tip of the elbow. So you want to put lesser of your weight on it, and then you can really aim into the valley between two different attachments. Perfect. Now, if you want to get even more into the glutes and you want to address that area from another angle, you can switch your arms out. So you're actually using the other forearm. You start out with the same idea. You imagine the simplified triangle. You start from the bone for orientation and you get into, yeah, exactly. You're already there. Perfect. Now you can use your left arm and just grab that ankle. Gently lift that foot off. Yep. And now you have a nice handle. Now be careful with this because this gives you a lot of leverage. You can easily get rotation in his hip joint just by moving this lever sideways. Exactly. You want to do this very slowly and carefully, and you can do this as a diagnosis as much as a treatment. You don't even need to make it a stretch. It's really just about using a little bit of movement. And in cases where people have a lot of problems in those areas, you will feel the muscles that are really jumping out at you by doing those movements that add a little bit of rotation. And then you can be even more specific when you find one area where you have this one really tight spot. In a lot of cases, that really is the piriformis. You might feel it like a ropey part attaching to the sacrum. And then you can get your elbow right next to it when you want to almost like get into that groove, give it a little bit more space. And you can do that on both sides of the muscle. You want to avoid shifting around. That has really no therapeutic purpose, and often it feels a little odd to the client. Now, we can add some rocking in some areas, but in most cases, I like being very slow, very targeted, and just giving their whole nervous system the experience that nothing sudden will ever happen. Because in areas where they're very sensitive or when they have specific problems, they always have enough time to speak up. And you will also notice whether they're tensing up. Anything that you do that goes into faster movements, when you're in an area where you're risking injury, you don't have time to say something. They're already in spasm, and then you pretty much have to start from the beginning. Yeah, people with really tight hamstrings, they love this. You can really get into the attachments where right underneath the sits bone, the hamstring tendons are attaching. Opening up space in there often helps people be a little bit more flexible, feel less of that pull. Now, if you want to be more specific, you can use these knuckles and try to make one straight line all the way into your shoulder. If you just sink in here, you already feel how you can really just drop your weight through this straight line. Now, David is very patient with us. Usually, if you have a real client on the table, you want to make sure that they don't feel like you're getting suddenly into their sensitive areas. In order to make it feel very safe, you start out from the outer side. So you almost start out from the trochanter just to get an idea of, okay, there's a bone, we know we're on the femur. Then from there, you move a little medial. And you just let your knuckles sink in a little bit. What we're looking for is the sit bones. You just let it sink in a little, like, okay, I don't know where I am. What am I doing? Usually the reflex you have when you don't know where you're doing is you start stirring and digging, which can feel really weird in that area. So try to just avoid it. Act as if you know exactly where you are and you just applied some compression, and then you get out of it. And then you move a little bit more medial, and then it's like, there's the sit bone. Good. And there's this weird ropey part that attaches to it. Must be a hamstring. Yay. So instead of really pushing on the bone, which is always uncomfortable, you just stay a little bit off the bone. And if it's like, you have the sits bone here, you have like this ropey bit on there, again, similar to how we were working attachments to the sacrum, you really just sink in on each side of it. And that's why I like using these knuckles, because you can just use this middle finger knuckle and really target getting into that dip. In some cases, particularly with athletes who have had a lot of injuries that might just have been mild tears, the inflammation, the wound healing causes these tendon attachments to stick more together. You can even have impingement of small surface nerves in those areas. So opening up some space between the tendons can really give a lot of relief for people who have chronic pain in that area. Well, while we're talking about hamstrings, you can use this soft fist stroke that we did in the beginning, really just getting the slow glide. Having the arm almost straight, you might have a light bend in the elbow so you're not overly locking it. Because when I'm locking that, my shoulder comes forward. So you want to be able to really drop in easily. But keep in mind that the more you're approaching a straight line, the more your weight can really transfer through. So it's a bit of a compromise in this area. And the most important part is that you get a sense that you're comfortable in your body and you have the sense that your own shoulder can easily settle down and in. Inwards, I mean the shoulder blade towards the spine. So from here, like we always do, you kind of aim into the valleys between different muscles. You want to go for better differentiation. And it depends how much time you want to spend here based on what is going on with this body. So there is not a prescribed amount of time that you would spend. You don't even have to get into all the different compartments. You can, in most cases, when you're doing general work and there's not anything particular going on with the legs, you might just do one stroke a little more medial, one stroke a little more lateral, and you can follow that all the way up into the attachments. Now, in most cases, this is a realistic setup because my clients usually wear sports shorts because I like it that they're able to get off the table, do a short evaluation, even during a session, but particularly afterwards, I want to make sure they stand up and they're fine and I have addressed everything I need to. So you have to negotiate the clothes a little bit. For this classic myofascial glide, you want to be on skin, but you don't have to be. You can also be on top of their clothes. In some cases, I work on people and they don't ever take any clothes off. You just keep in mind that in those cases, you have the same direction of the stroke, but you often don't get this glide. So when you don't worry about it. You just move on about an inch or so, and then you sink in again. It is a very similar effect on the tissue. You don't have any less therapeutic benefit. It just isn't as satisfying on yourself. So in my opinion, insisting on skin is more about satisfying the therapist's need of getting this nice feeling of how the tissue spreads out, lets you through, and you don't quite get that glide on their clothes. So you have to compromise a little bit and you just move on from one spot to the next, to the next. Now we have a whole nother class in order to work within those areas where you can really address superficial nerves. You can really open up space behind the knee that helps some people with arthritic conditions. For now, I want you to only imagine a little bit how, if you simplify, the hamstring tendons come down here and attach on both sides below the knee. The gastrocnemius comes up and attaches on both sides above the knee. So we have here in the pit of the knee, we have these crossover areas. Just sinking in carefully with the pads of the fingers above and below the knee fold, right where all these crossover areas are. And you're just peeling the hamstring tendons a little bit to the outside. And you can do the same thing to the gastrocnemius tendons, just in order to create a little bit more space in here. So that often feels really good for people. They feel like there's less pull on their knee, and it's not a lot of work. It's very gentle. So these are the few things where I actually really use fingers mostly because you don't need a lot of pressure. You don't need to be very strong. When we're looking at the calf, it is the exact same techniques. It's the exact same principle. You just want to make sure that you have the alignment right, that you don't put the torque on the leg. So look at how their feet are lying down. You want to make sure the heel is pointing straight up, that their kneecap is on the table. And then you imagine this angle in here where the soleus is underneath, the gastrocnemius parts open up in here. So you have the Achilles tendon in here, and then you almost have like this triangle up on top of it. And that's where you kind of focus your attention on in the very beginning. From here, you kind of want to imagine that you spread out these two different bellies of the muscle. In the beginning, I use my hands just in order to get an idea of where I am. And you can also feel like, you might be able to move it more to one side than to the other side. And then I know, okay, in his case, it's really easy to move medial. It's harder to move lateral. So since we usually don't have time to be really intense on the whole body, we want to focus on the areas that are a little bit tight. So then I say, okay, in this case, I want to use a soft fist, just move on the lateral side, and I'll just hang in here to where I feel the beginning of the muscle belly. And you just sink in a little bit, see where this is going. And then I'm moving a bit more medial, and I start bringing it outwards. Yeah. And now I have a bit of movement.
Your outer leg in front?
Oh, that's a good question. Right now, I think I just have my legs this way because I'm able to just bracket the corner of the table here, so I get closer this way. I always like to bring my body behind the stroke. So this is the direction I'm going, and so that's why I like to just have my legs arranged this way. If I was on the side of the table, I could also just move my butt a little bit on the table, could almost sit on the corner and do similar things. So it depends a little bit on what you're finding in the tissue, where you want to work on more. And in some cases, you might just find an area that doesn't quite move, and then you just leave it alone, move to the other direction, try to do the things that are easy, and then you get back to it. Leaning in, just giving it a little bit of connection, just hanging out there for a while can be a really beneficial therapeutic technique. So sometimes we need to get it out of our head that we want to release every trigger point we find, because in a lot of cases, those will release when you get closer to the attachments on the other side of it. You're working that out, and then you can get back to it and check on the tonus in there. Even if we don't want to focus on the feet, it would be bad to miss this opportunity because we have the sole of the foot so nicely spread out here. And if we have the bolster set up correctly and it's exactly the right height, we can spread the foot out, lean like the back of the toes against the table, make sure that the alignment is correct, the heel points straight up, and then we can just lean a soft fist into the arch. And that's where we're getting a nice stretch, we're getting some pressure in here. And with this other hand on the calf where you just instinctively put it, you can get a bit of a tug on the Achilles tendon, and you feel how this translates into the plantar fascia. So you can rock back and forth a little bit and give some relief onto the plantar fascia. In IT band work, I like to do it from the side just because it gives us this nice spread from here. And you want to start out really by palpating first that you find where you are. Now you're already right there. You're absolutely correct. Let's just have a look first, just in order. Sometimes it gets confusing and we're not entirely sure where we are. Now in David legs, this is very clear. You find one big tendon, you just feel around it, and you're like, okay, this is like one thing, and then you're thinking, okay, this must be the more lateral of the hamstring tendons. Then you fall into the next dip, And then you find another structure, and that is more flat. But it starts out with the same kind of tendon feel because the IT band is a tough band. So it's almost comical when people talk about stretching the IT band because there is not much to stretch. You can stretch a little bit of the muscle up top, but not even that is really stretchable. So usually when people say they have really tight IT bands, what their problem is not that this band is giving them stability for the outer side of the leg. What their problem is that this band gets stuck against the underlying structures. So often that's kind of still a bit of the outer hamstring area or the outer quads, and they through injuries, small areas of inflammation, they have it stuck together so that these different layers of fascia don't glide that like they should. So with every step they're taking, because there is this glide lacking, they feel this tug on the IT band, and that's why it feels tight. So an easy way to treat this is to really just peel it off. And we imagine the same thing that we were doing when we were working around the shoulder blade. So you want to really get an idea of getting a handle on it and moving it. So when you're using your soft fist, you might be using these knuckles or wherever you get right under the corner of the IT band. And then the direction of your movement, it's getting complex because you want to work on this outer leg. So you're going kind of up towards the greater trochanter, but you also want to have this bit of direction of mobilizing this corner of the IT band. So you have a bit of a compromise. So the direction you let your weight fall into is kind of at an angle. So you're doing both directions at the same time. The way that you're moving looks really great. I love that you give a bit of extra stability to his lower leg here, because in these positions we easily push people around. Now, we weren't so strict about positioning of the rest of his body because we're really just focusing on the IT band. And if he crunches himself up top and cuddles into his pillow, I don't care in this case because we're not working on the spine. This looks excellent, and you would just really follow up all the way until you hit the greater trochanter. So the movement really is that slow. I know that this is always the hard part when people are starting to practice this kind of work, because they always end up feeling like, oh, I'm not doing anything. And then they get worried how that feels to the client. And they get concerned that the client might feel like they're not doing anything. And that's really good when you're practicing with people who give you feedback, because they will tell you whether this feels like it makes sense to their body or not. So I often ask, does this make sense to your body? Is this feeling like it's accomplishing anything? And you'll be surprised, because often when you feel like you're just hanging out there, they have all these deep, amazing sensations, because it's the first time that they really notice different dimensions and layers in their bodies. So for the client, this can be a profound experience while you're having this internal dialogue going on of, am I doing enough? Am I really doing this?
And I find that if I go too deep, the glide stops.
Exactly. Yeah. Yeah. So and I love it that you already noticed this, because you want to be able to consciously work on different layers. And with a lot of clients, when you're just starting out, you will notice that you're just all the way on the top, and underneath you can't get in. But when you do good work and you stay patient with it, in the next few days after the treatment, they start slowly opening up. So when you see them again after a week, usually you can get to the next layer. And so it's really important to just keep this patience up and keep being okay with yourself not accomplishing everything in one session. Great.